Hi. So this video is for care assistants, domiciliary carers, support workers, nurses, healthcare workers that are currently on the Tier 2 visa and they have restricted work hours outside their current sponsor. Right, guys, I bring you good news. If you're in any of this category, working in the health and care sector in the UK under the Tier 2 visa, you need to watch this very video to the end because I bring you good news. Guys, my name is Jane Sampson and this is my channel. If you're seeing my face for the very first time, this is our community. Join this community. We serve it hot, real, and we bring it very, very authentic. Guys, there is good news. So like most of you know, the healthcare work visa, a lot of people who are on the Tier 2 visa know that your visa is restricted. You are meant to work for just your employer. And if you want to work for any other employer, you're just restricted to 20 hours. Well, I bring you good news. The has decided to relax this and you can work as much as you can. So very recently, a petition was started by a group of people, very thoughtful of them, and their petition, they were requiring signatures of healthcare workers or those that it affected to sign the petition so that they can take it to the Home Office. For the petition, they were demanding and asking that the years that was demanded for healthcare workers to get ILR, because usually, like most of us know, for you to get your independent leave to remain, which is what's known as the ILR, for you to get your leave to remain in the UK, you need to have worked for 5 years here in the UK. And the petition came up, a group of people came together and they brought up a petition where we all signed and we're saying, no, the 5 years is too much. We work so hard as care workers in the UK. We paid our dues. We need you to reduce this time. All right. Guess what? Over 50,000 people, almost 50,000 people signed that petition to say you need to look into this petition. And the good thing about this country is when such petitions are brought up, they are not just thrown under the carpet, they are considered as long as it gets enough signatures. Sometimes it goes as far as to the House of Parliament where they bring up this petition and they are considered. Well, even though that petition was not granted for the ILR years of leave in the country to be reduced from 5 years to 2 years, something also came out of it. So in that petition, they said clearly that this is already a standard that they've set for healthcare workers who are working in the UK to work for at least 5 years before they can attain the indefinite leave to remain. But that they were bringing up something also interesting, that they were considering relaxing the visa restriction, which entails that you cannot work outside your current employment beyond 20 hours. So a lot of people have, they work with their current employer for certain amount of time, but they can't work with other employers, for a very long time. So you can only do 20 hours if you want to work elsewhere, which was a very big setback for a lot of healthcare assistants. Well, the good news is that it has just been updated on the UK Gov website that this restriction has been removed. Guys, if you really want to see this, go ahead and stick with me to the very end. At this point, if you haven't subscribed, why don't you just consider subscribing? Join this community. We share hot updates just as it's coming regarding to living and working here in the UK. So go ahead and subscribe and like this video and share with your friends who are healthcare assistants. Let me show you on my screen so you see with your 2 eyes that of a truth, this has been truly approved. I am excited. I know this will positively affect a lot of people. All right, guys. So this is the health and care worker visa, one of the visas under the UK shortage occupation list. And this is where you have every information that is required to apply for, the documents you need, the cost, everything you need. But our interest today is taking on additional work. And I'll just be clicking on that just so we get insight on the updated information. So before now, what we had on this website was that you can only work 20 hours outside your current sponsor. So whoever you're working for, you can only work extra 20 hours for outside your current sponsor. So if you want to work elsewhere, you can only do so for extra 20 hours. And this was really affecting a number of people. More recently, I've heard stories of, I've gotten a lot of people gotten across to me to say they've come into the UK, but their employers do not have enough hours for them. And this is really affecting them, especially domiciliary carers. A lot of employers are just bringing people into the country. They just come in, especially those who are paying for their COS. Unfortunately, they come into the country and their employers don't have enough shift for them to cover. So they are struggling financially. They are not sure what to do. They can only do 20 hours with other employers. Well, this is good news for everybody. You can now work as much as you want. So here it says, taking on additional work, you can do additional paid work on a healthcare work visa as long as you're still doing the job you're being sponsored for. So remember, even though you can do extra hours with your other employers, you must complete your specific hours for your current employer. All right, so you don't just dump your employer and then start working for your contracted hours with your current employers must be fulfilled. So the extra time that you have to work, you can now do more work. So it says you may also need to update your visa to do additional paid work. Okay, this will depend on the type of work you are doing and the hours you're going to work. Now, this is the part that interests us. It says work you can do without updating your visa. So before now, if you want to do more than 20 hours, you need to update your visa. You need to apply to say, okay, I need more hours. But they're saying here that if you're doing extra job, is also eligible for health and care work visa. All right, so whatever work you're doing, it must be under the health and care work visa. So it must either be care assistant, domiciliary care, living care, working in the hospital. It has to be under the health and care work visa. It says you can now work as many hours as you like without updating your visa. Before now, it was restricted to just 20 hours. So that's good news, especially for those who are complaining that they don't get enough hours from their current employers, or those who just want to make extra money, who just want to gain more experience from other settings. So I know some people who are working with domiciliary care, but they want to gain experience of working in the hospital. This is a great opportunity, okay? So it's good. Further down, it says if your job is not eligible for a health and care worker visa, you can still work up to 20 hours a week. If, for example, if you're a dietitian from your home country and you're currently working in the UK as a carer, so you can do your full hours as a carer and then you can do 20 hours as a dietitian if you get the job. That's what this clause here is saying. Okay, so it says check if your job is on the list of shortage occupation. Guys, there are so many jobs on this shortage occupation. Unfortunately, a lot of us are just focused on the health and care work visa. But if you go through this list, you might be surprised. You might find out that your job that you read in the university might be in this shortage occupation. Okay, so it gives more information. It says further that if you want to update your visa, but if you want to get a job that is not an eligible health and care work visa or in the shortage occupation, you can work more than 20 hours in a job that is not under this eligible shortage occupation list. Okay, so it said to apply, you need to get a new certificate of sponsorship from your second employer, and this is if you're doing more than 20 hours. This is for job that is not on the shortage occupation list. All right. Well, guys, our concern is the fact that you can now do more than 20 hours. And if you ask me, this is really, really exciting news, guys. It's exciting news for a lot of domiciliary carers who want to gain more experience, outside their domiciliary care. It's exciting news for those who want to gain other care, experience setting. It's exciting news for those, who are currently struggling financially and they just want to work more hours, okay? Guys, remember, do not overwork yourself. Don't use the opportunity and say, oh, I can now work myself to death. Remember to place the limit. Remember to rest. Remember to know where to place the boundary. So at the end of the day, you're working and you're also enjoying your money. So this is exciting news. Let's share this video to all that would need. This is really, really exciting news. All right, guys. So I hope you enjoyed this video. I hope you got value. If you got value, go ahead and subscribe. Join the family. Consider subscribing to this channel. I try to share updates as much as I can on this channel. And hopefully, guys, I will see you in my next video where I'll be sharing more companies that are recruiting into the UK. I'll see you guys in my next video. Take good care, guys, and bye-bye.